What are lesions? Do you know anything about lesions? Let us see. A lesion is any damaged or abnormal area of tissue in the body. Since they happen in so many different places and type of tissue, they have many different causes and means of diagnosis and treatment. Most lesions are broadly categorized by when they appear in the body. For example, skin and mouth lesions are some of the most common types. Both they are also site-specific ways of categorizing them. The effect of any particular area of abnormality depend on its placement, type and size. Skin lesions can be either primarily, which means they have cause a variation in color or texture of the affected skin, or secondarily, which include things like the scrabbing that naturally forms on a abrasion or peeling that follow a sunburn. Moles, birthmark, wart, and hives all over common primary types, while skin ulcer, scrap, fissuras, and lichenification are also common secondary type. Skin abnormalities can be categorized by the site, appearance, and whether they are cancerous or not, or non-cancerous. As this type of damage can be caused by so many different things, the way they are treated varies. If they are caused by an infectious disease, then doctors generally try to treat the underlying condition rather than lesions themselves. Sometimes topical antibiotics can help prevent further infection. Other topical treatments such as cortisol cream can be applied to soothe itchy or irritated skin. In many cases, treatment from harmless skin damage is primarily cosmetic. For example, patient may resort to laser surgery to reduce the appearance of mole. Though the vast majority of skin lesions are harmless, some can be an indicator of skin cancer. Moles or birthmarks that have uneven edge or have a change in color may be cancerous, particularly if they are larger than 0.19 inches, that is 5 mm in diameter. Next is mouth. Oral lesions include any type of tissue abnormality in the mouth, like dental caries or cavities, herpes, blister, ulcer, gingivitis, and inflammation from yeast infection. People who smoke or chew tobacco are more likely than those who do not get some type of oral problem, including oral cancer and hairy tongue. Good dental hygiene can be very effective in preventing many type of oral lesion. As with skin damage, the treatment for oral abnormalities is generally focused on treating the underlying cause. Some oral condition can be treated like gingivitis and yeast infection, but others like herpes blister cannot be fully cured. For conditions that can be treated, dentists may advise patients to use medicated mouthwashes, gel, and toothpaste, as well as tongue scraper for conditions like hairy tongue. Lesions that affect the inner tissues of the mouth, like oral cancer, may be surgically removed. Debridement, a procedure in which dead tissue is removed, may also be used when the tissue is severely damaged, along with antibiotics to control infection. Next is brain. Brain lesions are associated with a range of conditions including Alzheimer's disease, meningitis, multiple sclerosis, and cerebral palsy. Tumor, physical trauma, and aging can also cause the type of damage, as can bleeding like that for a stroke. Environmental factors like exposure to toxics can also cause brain abnormalities. Some remain small enough that they don't cause any symptom. If this is the case, doctors often take a wait with and see approach, monitoring the area to make sure that it doesn't start to cause damage and treating it if it does. Depending on the cause of damage, doctor may be able to treat some type of brain lesions. For example, a brain abscess can often be treated with antibiotics or antifungal medication. Other abnormalities can cause permanent damage, though there are sometimes ways to treat the symptom caused by the damage as in case of a stroke. Damage caused by other conditions like Alzheimer disease are progressive and not treatable. The location of damage can also have an impact on a treatment. For example, it is often more difficult to treat tumors that are deep in the brain than those are close to the surface. Next is lungs. Most lung lesions are caused by either bacterial or viral illness or cancer. Sometimes cyst holes or scar tissue can form in the lung as well. There are also several types of congenital lung abnormalities, including congenital cystic adenomatous malfunctioning or malformation CCAM and lung sequestration. One of the most common type of lung lesion is solitary pulmonary nodule, that is SPN, which is beginning or typically benign tumor but can be malignant in about 1 in 5 cases. Tuberculosis also causes lung lesion, which may reactive after the treatment and cause another round of disease. Many people with the type of lung problem don't know they have it or find out when they get diagnostic like magnetic resonance image, that is MRI, done for another condition. There are a variety of treatment available for these abnormalities, ranging from surgery to chemotherapy in the case of cancer to antibiotic in the case of tuberculosis. Not smoking and avoiding environmental factors like air pollution and asbestos can help prevent this type of lung cancer. Let us talk about other lessons. People can get a lesson essentially when they get a tumor. So the liver, pancreas, genital, intestine, kidney, bones, eyes, gallbladder can also be affected as well. Kidneys and pancreatic cysts are particularly common. Cells are molecules can also get lesions as in the case of sickle cell disease. This is all about the lesions when produced from different part of our body. I think this sort of speech have helped you a lot in understanding the lessons and how they can be cured or from how they are being produced. That's all for today. Have a great day ahead.